An inherited retinal disease, or IRD, is a condition caused by a genetic mutation or mutations that lead to vision loss or blindness. To date, researchers have found over 300 genes that can cause IRDs. Genetic testing may help pinpoint which mutation causes an IRD and can provide important information as more clinical trials and treatments are developed. Leslie Colvin James is a genetic counsellor in Southern Alberta and joins us to share more about this process.
I am a British-born, Canadian-trained master's-level genetic counsellor who currently works as an allied health professional in Southern Alberta. I support a pediatric medical geneticist and a genetic ophthalmologist, that's a lot of long words, who provide diagnostic services to children and families. A portion of my time is directed within the ocular genetics clinic.
What does a genetic counsellor do?
Generally speaking, genetic counsellors see individuals with an established diagnosis to provide genetic counselling, testing, education, and support to individuals with that diagnosis. We can become involved at various points in a person's journey, and our goal is to help individuals understand their condition by answering questions about the cause, natural history, inheritance, and management recommendations. When I first started in this field, approximately 20 years ago, our goal was to help families adjust the diagnosis through education and to connect families with others with the same diagnosis to reduce the isolation, often through support groups. Increasingly today, we're asked about new developments and possible treatments for genetic conditions. Genetic testing technology has improved exponentially, and we're better placed today than ever before to be able to identify the specific genetic cause of inherited diseases. As genetic specialists, we also understand the limitations of the current technologies and some of the gaps in scientific understanding, and we can contextualize the information for a client's unique situation. In the eye clinic today, I mostly see individuals with possible inherited retinal disease. Questions that we often hear are, what are the chances that I might pass this condition on to my children or grandchildren? Or are there any treatments or cures for this condition, either now or coming on the short-term horizon?
How does someone get their genetic testing?
Typically, a person needs a referral to a genetic clinic from their doctor or a low vision specialist. Once the referral is received, the genetic counsellor will review the supporting medical information accompanying the referral and identify whether there is missing medical or family history information. You may be asked to help gather the missing information in advance to make sure the appointment is more efficient. As there is growing demand for genetic services and only a limited number of trained and qualified professionals, it's not unusual for there to be a wait to be seen, and this time can be used for this purpose. At the first appointment, the genetic counsellor will review the clinical and family history information and clarify the questions the client and the specialist have. This helps us to select the most appropriate test to answer your questions. In Canada, there's not usually any associated cost for genetic testing, and typically the testing is just a specialized blood or saliva test. It can, however, take several or many months for results to return. It's important to know that not all genetic testing is the same. Depending on the question being asked, your genetic counsellor might select a big, broad test encompassing many genes or a simpler, more targeted test. Rest assured, they will pick the test that can best answer the questions that you and your specialist have. Even though advances in technology have brought down the cost and time involved in finding genetic variants, the key to meaningful answers is in ordering the right test and carefully describing the full clinical picture to help the laboratory specialist to interpret the findings accurately. It takes good communication between the lab, the ordering clinician, and the specialist to achieve meaningful results. Though it's possible to find and order private genetic testing, not all genetic testing will look for the same things. More is definitely not always better, and your genetic counsellor can give you clear answers tailored specifically to your situation when you meet with them. I do strongly advise waiting for an appointment with your genetics professional to make sure the testing ordered can detect the important genes and types of mutations that we're trying to find.
Once someone has completed the testing, what happens next?
When you meet with your genetic counsellor to receive your results, you should expect to understand how the questions that were asked at the beginning of the process are answered by the test, i.e. the meaning of the results in your specific context. In the pre-test appointment, your genetic counsellor should indicate the kinds of results you might receive and should go over the meaning of your results in your specific situation when they share them with you. Results may be a clear positive or negative type result, or they may be more nuanced with possibility of ambiguous results as well. If the specific variant has been detected, this is called a positive result, and the genetic counsellor will share how this applies to you. It may encompass new information about inheritance or support a diagnosis already given to you by your vision specialist, or it may reveal new information about availability of treatments or clinical trials. Your vision specialist may also need to meet with you to share how the result might impact their management for you. A negative result means different things in different contexts. Simply put, it means that the genetic variant was not identified. But it doesn't always exclude a genetic cause, so the genetic counsellor will provide a personalised interpretation to you and discuss any additional options if needed. Sometimes the result is ambiguous. Your genetic counsellor will talk you through what has been found, what it means, and if there are any options to try to clarify the result, such as testing other affected or unaffected family members or other measures. They can often help to try to organise any follow-on family testing that's suggested. Sometimes the result may take time to resolve, and you will be asked to reconnect with the clinic after a few years.
Why do you feel genetic testing is so important?
Over time, I can see that there is a fundamental shift in how diseases are now classified as our understanding has advanced. This is occurring across all areas of medicine, but it includes a shift to include the gene name with the clinical condition name. So we're beginning to hear about USH2A Usher syndrome and RPGR-associated retinitis pigmentosa or ABCA4 Stargardt macular dystrophy. The importance of the gene name is that it tells us what and where the mistake is that results in the clinical symptoms, and it can suggest new targets or types of treatments such as immune therapy or gene therapy. Finding out your genetic diagnosis may unlock information about things that are specific to your condition that are not even standard of care yet. This is not unique to ocular genetics. It's happening in other areas of medicine too, such as cancer, and with other inherited conditions such as cystic fibrosis and blood diseases. The very first gene therapy for an IRD was approved by the FDA in 2017 and by Health Canada in 2020 for a rare form of LCA, Leber's congenital amaurosis, which is a progressive, early onset form of inherited vision loss. Despite that approval, the pathway from approval to coverage has been slow, and this gene therapy, called Luxturna, is not yet standard of care in any province, as far as I'm aware. In addition, this condition is very rare and will only be helpful for a small percentage of our patients. However, this really is the tip of the iceberg and reflects sustained efforts by many clinician scientists, lab researchers, to understand what has gone wrong and to find effective personalized treatments for genetic conditions and to prove their effectiveness in controlled clinical trials. Genetic registries such as Fighting Blindness Canada Registry offer enrollment to individuals with an IRD who have a genetic diagnosis as well. The goal of the registry is to inform individuals about new developments that are pertinent to them in a timely fashion. So ultimately, this is the possible benefit of genetic testing. But to be fair, we still cannot always find the genetic diagnosis for our clients, and decisions about whether this is right for you will depend on your unique circumstances. Only you can know if this is something that you wish to know about and when.
Inherited Retinal Disease Awareness Month takes place annually in September and recognizes genetic eye diseases that lead to vision loss or blindness. For more information on IRDs, genetic testing, and the FBC Patient Registry, please visit us online at fightingblindness.ca/IRD month.